Okay friends, today I will talk more on designing aspects of a hospital building. Before even you start to attempt to design the hospital, the first thing that you should do is prepare a functional space program, by which what I mean is you enumerate all the types of departments, number of rooms that you have. So for example, if it's an outpatient clinic, so we need to then prepare an Excel sheet table and put 10 OPDs into 150 square feet, reception, toilets, giving area to each of these, and then keep on adding other departments into this space program. Remember that you need to add about 30% circulation area, for a free area within the department, which is like internal corridors and other things. And then on top of, when you add all departments, you need to add another 20%, for vertical circulation, the main circulation, the lift, course, and the staircases. So as a thumb rule, this secondary area, which is there, the circulation area would be approximately about anywhere between 30 to 40% of the overall build-up of the hospital. The next important thing that you do, because this is your Bible, the next important thing that you do is you study the bylaws which are prevalent in the municipality or the city where you are designing the hospital. Where there will be rules which will govern the height of the building, the ground coverage of the building, that is the footprint of the building that you can occupy. There are rules regarding to parking, there are rules regarding to how much is the height of the floors which are there. So there are various these kind of rules that you need to understand well. For example, in Hyderabad or Andhra Pradesh in India, there is no rule like an FSI. You just have to keep a setback from the boundary line, and you can have a particular height of the building which is related to the setback, and you can build as much as you want. So there are, plus they also say that they need a ramp, mandatory for whatever be the size of the hospital. So that's a very different set of rule. If you want to design in Bombay, will be different, design in Guwahati will be different, design in Dubai will be different. The other thing which is important while you're designing to understand is if there is any phasing in the hospital, then you need to take care of that, be it vertical, be it horizontal, so that you need to plan now. So all your redundancies in terms of water tank capacities, space to be kept for extra transformer, extra generators, extra chillers will need to be thought upfront. This is very common when we design campuses, which are more than 500,000, 1500 beds kind of a campus, when we do something like that. One thing which probably in India we don't practice as much is how to orient the building with respect to the sun and the rain beating. If you do this carefully, you could reap the benefits of bringing in natural light deep inside into the building. Creation of courtyards, slanting of windows. Similarly, shading, for saving direct sunlight hitting, your key areas can also reduce the load on your air conditioning systems. The next is the key thing that you decide in a hospital design is to do with the grid. Grid means the column distance between two columns. Now if you look at government hospitals, a grid of 6.5 meter works good. But when you come to corporate hospitals, modern hospitals, a grid of 8 to even 9 meters is more conducive to design departments like operation theatres, intensive care units, laboratories, radiology imaging and things like that. Having done this and having done the space program, the next important thing is to do a stacking of these departments. So what I mean is which department will come at which level of the hospital building, and that has a relationship with adjacency of certain departments. Like for example, CSSD and operation theatre and surgical intensive care, maternity with an ICU, outpatient clinics with radiology imaging with casualty, those. So these kinds of adjacencies will derive you a stack program which is there. And last but not the least, whilst you are doing all of this together, please remember that now there is NABH, National Accreditation Board of Hospitals in India, and there are certain infrastructure norms that you need to follow diligently. Some of them being A 2.4 meter corridor, is a must. 2 meter wide staircases are must. Fire protection norms are very strict. Height of operation theaters, are predefined. Filtration of air predefined. So these are some of these aspects, which you should not ignore, because NABH probably is going to be the future, and most insurance companies are going to follow NABH guidelines. So I think if you do these things, you would design a good hospital.